pelvis, the inlet and outlet, and the difference between the male and female pelvises. So we'll discuss the differences. We'll do the superior and inferior circumference and the boundaries of the pelvis, know the anatomical positions and the shapes and the different sizes of the female pelvises. So you already know that the pelvis is more like a basin with a stout, strong, bony ring, and which is present between the vertebrae on the back and suspended by the femur and the head. Its composition comes from both the hip bones, which are the innominate bones, and the sacrum and coccyx at the back. The innominates articulating in front at the pubic symphysis. Here we have the ilium, the pubic bone, the superior pubic ramus, the inferior pubic ramus with the ischium, ischiopubic ramus over here, the ischium over here, the ischial spine projecting from this point, and the acetabulum on the lateral surface. All in all, it's a tough, stout bone with the sacrum intervening between the posterior ends of the innominate. And on top of the sacrum, you can see the articulating surface for the lumbar vertebra, lower lumbar vertebra. Below, you can see the coccyx over here. These are the ischial spines projecting within the cavity. So, this being an oblique line with this portion with a definite upward tilt and this one a little downwards, this oblique plane passing through the prominence of the sacrum over here, the most prominent part of the sacrum, coming all the way up to the pectineal line and the arcate line. This is the area which divides the pelvis into the upper pelvis over here, formed of the ilium, upper part of the sacrum, and the ischiopubic ramus, the superior pubic ramus, and the lower pelvis, which lies underneath the pelvic rim over here. So this is the greater pelvis, and the area below this oblique setting is the lesser pelvis or the true pelvis. The circumference is called the linea terminalis or the pelvic brim. The pelvis major or the false pelvis is the expanded portion of the cavity over here. And you can see that it's situated above and in front of the pelvic brim. On both sides, we have the two ilia, the iliac bones. In front, we have this area which is incomplete, deficient in any bony structure, and forming a wide interval between the anterior borders. These would be the anterior borders of the iliac bone, and this is widely open, left open. Posteriorly, we have a wide notch lying between the two iliac bones, and that notch is partly filled up by the sacrum or the base of the sacrum over here. So the lesser or the true pelvis, the pelvis minor, is below and behind the pelvic rim. The bony walls are kind of more complete. It has an inlet over here, bounded of the superior circumference, and then it has an outlet which can be seen over here. This is the outlet or the lower inferior circumference. And in between the superior and the inferior circumference, we have the cavity of the pelvis. So the superior circumference or the pelvic brim is also called the inlet or the superior aperture. As you can see over here, this is somewhat heart shape, but this shape may vary from type to type. So laterally we have the pectineal and the arcate lines. Anteriorly it's the pubic crest over here, that is evident. And posteriorly we have the base of the sacrum and the sacrovertebral angle over here. So the pelvic cavity is measured in an anterior-posterior diameter, which is also called the conjugate diameter. It's measured in a transverse diameter and an oblique diameter. Now, in this diagram, you can see the anterior-posterior diameter, which extends from the sacrovertebral angle right straight up to the pubic symphysis. There is a transverse diameter extending from the middle of the pelvic brim from one side to the other side. And then there is an oblique diameter extending from the iliopectineal eminence over here, right up to the relation of the sacroiliac joint, lying very close to it. So we have an anterior, a transverse, and an oblique diameter. Now, if you see the figures given in this slide, you would notice that in all dimensions, the female diameter is greater than the male diameters. Look at the conjugate diameter or the AP diameter, anterior-posterior. The female measurements are 110 millimeters compared to the man, which would be in the males would be 100 millimeters on an average. Similarly, transverse diameter, the females have a larger transverse diameter compared to males, and same applies to the oblique diameter, which is relatively larger in the females compared to the males. So the cavity of the lesser pelvis, you already know, is short and a curved canal. Deeper on its posterior wall is because of the presence of the sacral curve. This cavity contains all the viscera of the digestive system and the reproductive system. The terminal viscera would be the colon, the rectum, the bladder. In the female, they would have the uterus and the fallopian tubes along with the vagina. In the male, they would have the prostate, the seminal vesicles, and the male urethra, etc. So the lesser pelvis is in front and below bounded by the pubic symphysis and the superior pubic ramus. Above and behind by the sacrum and the coccyx, and laterally it's bounded by the inner surfaces of the body and the superior ramus of this ischium and part of the ilium, just below the arcate line. So the outlet or the lower circumference, as you can see, is very irregular, going into slants and prominences and spinous processes, which are smoothened out by the presence of the different ligaments over here. So all in all, this, along with the formation of the attachment of the ligaments, when you look at it, it is in the form of a lozenge. The lower circumference has the pubic symphysis up front, the ischial tuberosities on the sides, on the two sides, and the coccyx at the back. The you can see, if you compare the female side to the male side, you can see the difference in the size of the outlet and also in the shape. The male lower circumference of the pelvis is more or less oval in shape and much narrower compared to the lower circumference of the female, which is much wider and more or less hard or lozenge shape, thereby permitting the head of the fetus to pass through it at the time of parturition. So, if we compare the different diameters of the pelvic cavity in the males and the females, you would see that the superior pelvic aperture, again, all the three diameters, the anteroposterior, the conjugate, the transverse diameter, and the oblique diameters, are narrower in the smaller in the males compared to the females, which are much larger. Similarly, the pelvic cavity of the female is larger than the male in all the three diameters, the conjugate, the transverse, and the oblique diameters. Likewise, when you compare the inferior pelvic aperture, you will notice that again, the females have larger measurements compared to the males.